With heat records breaking across our province, we thought it's time to talk about the risks that come with that rising heat. Joining us is our regular medical columnist, Dr. Melissa Lim. Nice to see you again. First of all, remind us, who is most susceptible to heat and why?
Anyone whose nervous system doesn't respond to the effects of heat as effectively is most susceptible. So this includes groups like babies, young children, elderly people, and also people with chronic diseases, especially if they're taking medication like diuretics or psychiatric medications that impair their response to heat. And then also people who don't have as much control over their environments, like people who are unhoused, people who have to exercise or work outdoors, and also people who don't have access to indoor cooling. And that includes about 50% of people across BC right now.
So for those who are outside or with a loved one, what are those signs that they should watch out for, and in themselves?
Well, there's so many different illnesses that heat can cause, anywhere from mild conditions like heat rash to more severe things like triggering a heart attack, or more directly related to heat stroke. And we know that heat stroke can cause issues like nausea, dizziness, and hot flushed skin, but the red flag sign you have to watch out for is changes in level of consciousness. So unconsciousness or confusion. This should be a sign that you have to get them to medical attention immediately, call 911, cool them down right away. And there are things that we can do as well to prevent heat strokes. So, for example, drinking lots of fluids, avoiding alcohol and caffeine because that can dehydrate you, avoiding really salty food too because that can worsen swelling, and then spending time in cool areas, cooling centers during the daytime, and then also accessing the provincial government's expanded free air conditioning program or rebates for electric heat pumps if you qualify.
Now, those options are great for people who are able to get out and perhaps to a cooling center or to a library during the day. What about at night when we know, if people don't have air conditioning or a breeze and it still can stay that hot and it's hard to sleep?
Well, this is when a lot of the problems happen, when our bodies don't get a break overnight from that marathon that we're running during the day of trying to keep our bodies cool. And so you have to remember airflow and water are ways that you can stay cool. So for example, wearing wet clothing, misting yourself, running those electric fans, taking a cool shower or bath, and then also sometimes even wrapping ice in a towel and putting that on your body. These are all things that can make a difference.
We are not in a heat dome. Certainly we saw the horrific effects of that in 2021, more than 600 people killed by that. As much as you'd like to share, how did that, really a disaster, change how you practice medicine?
Well, I think this affected a lot of us as health professionals, and many of us are still dealing with the mental health effects, for example, of what we saw. This was the worst weather-related mass casualty event in Canadian history. And I remember seeing more patients with heat illness than I ever had in my entire career. And I spoke with colleagues in the ER who said that these were the worst shifts of their careers. They were literally running from room to room, intubating patients, having seizures and unconscious from heat stroke. And I think for me, this really brought home this idea that 80% of our health status comes from factors outside our healthcare system, like, for example, climate change that made the heat dome 150 times more likely. So it made me do two things in my practice. One is make sure that my own patients are more prepared for the effects of extreme heat, and then two, really commit to advocating for healthy public policy that makes sure that we're counteracting climate change, because arguably that will have an even bigger impact on my patients' health than what I do in the office.
Dr. Melissa Lim, we always appreciate your time and your expertise. Thanks again.
Thanks, Dan.